Well, good afternoon, everyone. We have with us today Christy Burch, who is the Executive Director of the Women's Crisis Center. And we have so many organizations in Northern Kentucky that do so much great work. And Women's Crisis Center has been around for a long time. And Christy's the Executive Director. And before we get started on the effects of the pandemic, so Christy, maybe you could just give our community an update. What is Women's Crisis Center about? And give us a snapshot.
Well, I so appreciate you, Judge, and thanks for having us on. Every single day, when we wake up at Women's Crisis Center, we try to do two things. That is take the absolute best care of people who are impacted by what we call power-based personal violence. So domestic violence, sexual violence, stalking, bullying, child abuse, those kinds of things. So we want to take the best care of people already hurt, but simultaneously, we want to make sure that we're reducing those numbers, that we're working with our communities to engage folks to try to keep people safe in the first place. So Women's Crisis Center is a 24-hour agency, and we serve men, women, and children who are impacted by violence. And we've been around for over 43 years, as this beautiful region knows. They've been incredibly supportive of our work.
And it's always been done so quietly, and that's done in some cases because you want to be kind of to some degree unseen by potential perpetrators, I guess, et cetera. But you also, you need to be exposed to know that people can come to you.
That's right.
And get help in that 24-hour need that is in our community, even though we don't want to sometimes admit it, it's here. How many different unique individuals will you typically serve in a year? And I understand really you've got 13 counties you serve, but how many individuals will you serve in a year?
So last year we served about 17,000, or we provided about 17,000 bed nights, and that's about 400. It was around 465 individuals that utilized our shelters.
Wow.
We also do we provide free counseling. We go to court with people. We respond to every single emergency room call for a sexual assault or domestic violence in our region. We provided about 10,000 free counseling hours. Anything that you can think of that a family or an individual who's been impacted by violence might need. We do those wraparound services as well. We served about 15,000 folks with our prevention efforts. So we're out there doing all of these different things to work with folks in our community.
So now you've been dealing now for a number of months with this pandemic, and you've got clients who normally would be housed in a much closer environment. You've got to deal with that. So walk us through what that's looked like for you and what you've had to do to continue serving your client base.
Well, just like every single agency, we've had to pivot really quickly. We went to providing a lot of our outreach services to a telehealth model. We went to copious cleaning. We went to different sets of teams so we could make sure we had a healthy team to come in and serve the folks. But what I'm so amazed by the Women's Crisis Center staff, we're committed to not really reducing the number of folks we serve, because we know folks need us now more than ever. So we've taken some folks and we've housed them in alternative locations to create more space. But we're really committed to making sure that we provide those beds. We've already been full as Women's Crisis Center since 2018. And so we were already looking at how do we increase capacity. And now more than ever, we've had to take incredible steps to make that happen so we don't lose anybody, because folks need us.
And so I've heard that question. It's been asked of me, in fact. I was saying, do you, during this time when we're all have been typically locked down at home, or not locked down at home, but we've been staying at home, has the need been higher, the same for your services? Speak to that a bit.
It was really quiet at first, which made my gut hurt, because I knew that violence hadn't been reduced. But again, that folks really need us and couldn't get to us. What we're hearing from folks, when somebody's going out to the grocery store, they're literally calling us and say, I have 2 minutes to make this phone call. When people are calling our crisis line, we're actually hearing active fighting in the background. And people can often not get the information that they need, actually. And so we are seeing the uptick. Literally in the last couple of days, in a 2-hour period, we got 5 requests for shelter, and we were already full. And so we're seeing that uptick, but we know that isolation has limited the capacity for people to reach us. And so we've really had to look at how can people text us? How can people reach out to us on social media if they can't give us a call and get the information that they need to get to us?
So you've really been operating as in a unique model with this little higher demand and in some cases fewer tools to deal with it. It sounds
Right,
like.
right, right. And families have fewer options, or individuals have fewer options. Many times people would go to a friend or a family member to escape violence as well. And now because of the pandemic, they're afraid that they'd get their family member sick. And so our services again are needed more than ever because they don't have those options either.
And through the years, you've been teaching the community about this for a long time, but it seems like every time I speak to you or someone from your organization, I learned a little bit of extra information about, what we can do. But for those who are maybe just learning about Women's Crisis Center or might be thinking, hey, what could I do to help? What's the greatest need right now that this community could rally around you and your clients and your mission?
I think there are two things. Be an active bystander. So even in the midst of this isolation, if you see something, or if you hear people fighting in their neighborhood, or you can check in with somebody you think might be being hurt, that has the potential to save someone's life. It truly has that potential. And so to be that active bystander, as well as remember us, that we haven't stopped working, and that in fact, our demand is even more. Our resources are down, and then the demand is higher. So if you can support us in any way, we could greatly utilize those support services and support resources.
Well, and I tell you, we could talk to you forever about this, but I guess on behalf of the community, saying thank you for being there, and your team always will send that appreciation to what you all are doing on a daily basis. So thanks so much for spending a little time with us today.
Thank you so much, Judge. We appreciate it.